So how are we doing in terms of time and energy for listening? Are you okay to continue? Do you want to stand up? Or do you want to take a break for 5 minutes? I don't know what you want to do. No, will we keep driving on? Okay. I don't know. What time are we finished at? What time are we finished at? Not that I want to finish up, I just want to know. 9:30, so we have an hour left. Okay, that's good because we'll be able to get to the stuff that I want to cover. But if you want to take a break, we'll take a break. I know it's hard to sit for an hour. Normally with the student, when I do classes, I say after 20, 40 minutes, we go for a walk, we just take a break and we come back and then a little bit fresh, but maybe we can continue. So this is what we call about the perinatal period. Again, there's many, even, just if you really want to understand how, there's different, I suppose, understandings of, healthcare, timeframes, issues. If you look at the diagnosis for the perinatal period, this is what would be in the research, the epidemiological papers would tend to be it's over this period. If you look at the WHO have a completely different definition of what the perinatal period is. So if you look at the perinatal period definition by the WHO, a lot of what I'm talking about doesn't happen during that particular period. So even a definition is usually important in terms of what we are talking about. So again, it's got to be clear, and I teach on many different programs, but it's got to be clear that we're talking about the same thing. So when the student talks about, what a carer is or what something is, you've got to define it so that you're not thinking. So I've been talking about the perinatal period. You might think it is this, the other person might think it's that. So we have to be clear about definition. So this is what I call the perinatal period. And this is what the research studies that look at the perinatal period call the perinatal period for now. Because there's people starting to look at beyond the actual, beyond the first year. And what's really interesting is that all the research was done in the postpartum period, whereas now we have strong evidence about the incredible importance of the antenatal period for mental health and well-being. Okay, so I'm going to talk to you next. So we've kind of talked about men's health in general. I'm going to talk about something that I find extremely interesting. I'm going to talk about the transition to fatherhood, okay? So we have the transition to motherhood and we have the transition to fatherhood. I'm not going to talk about the transition to motherhood. I'm not an expert on it. So I'm just going to tell you what I know about the transitions of fathers to during the perinatal period. So the research today has told us that during the early postnatal period, when a woman is in the early stages of pregnancy, fathers tend not to be connected. It's something that's happening outside of them. So there's a lack of explicit evidence in terms of the pregnancy. For a woman transitions both physically and socially. You have the physical signs of the growing baby, the kicking baby, but a very important part of any transition is how the transition happens socially. So the woman starts to prepare mentally for the delivery. Oh, how far are you gone? Oh, look, you're pregnant and you're searching for, so there's all discussions around it. It's real to you. Whereas with the man who's going away and doing his own thing, he's not, really, it's not often tangible to the man in the early postnatal period. There's a qualitative study that I did, and, a lot of the fathers, when they talk about their emotions and when they talk about the transition, they basically say that they didn't feel attached at the early postnatal period. It wasn't something that was tangible to them, and it wasn't something that they felt at times, I suppose, it wasn't as evident that they were to become a father compared to the mother. Again, in this period, fathers tend to attend a lot of appointments, and it's a golden opportunity to engage fathers in healthcare. However, the discussions in terms of the evidence really state that, you know, and there are many papers out there, and the paper that where it's being reviewed at the moment states that, you know, during this period, fathers feel, you know, sidelined. They don't feel part of the process. They don't feel brought into it. They feel unsupported and important during this time. Now, when fathers interact with healthcare professionals during this period, it's very important to emphasize that the father is not a patient of anybody. The father is not there to be receiving patient care. The mother is a patient, the infant is a patient, the father isn't. And that makes the whole thing a little bit more muddied, the waters. It makes it a little bit more complicated in terms of supporting fathers in this period. They don't have a medical chart. They don't have a medical record. They don't have a medical number. However, during this period, it's a period where, you know, obviously this has been said, this has been felt. And again, it's an opportunity to engage, even if the father isn't a patient. Just like when you come to the hospital, and if you're the carer for somebody and you're looking after the person and you're talking to them and you're treating them, it's hugely important to ask the carer how they are, because that person will be going home to that carer. And if that carer isn't doing well, then that person is going to be back into you. That carer will be the person holding up the system. And all the evidence suggests that the greatest support to a mother is not the midwife. It's not the GP. The greatest support to a mother is her partner. And when there's a lack of support from a partner, it becomes problematic. And the whole process, physically and mentally, becomes more challenging when that doesn't happen. So during this period, we have an opportunity to engage with fathers. It doesn't have to be a screening. It doesn't have to be anything that is medically related. It can be a question, how are you? How is this for you? You know, and are you doing okay? And how do you feel about this? And then, unfortunately, you don't have a referral pathway, which is usually important, but it's something to begin a process for maybe thinking the father. In the later pregnancy, as men begin to transition, what we start to see is they start to worry about the birth and the labour and the outcome of that. Okay. And they start to focus on what's going to happen. And this is the period when it becomes, for many men, a reality. The imminent birth is going to happen. Oh, it's time to act. It's time to do something. So what do men do? They paint the bedroom. We busy ourselves, and that has come out in research. When you ask father, what do you do to prepare? Well, I'm going to paint the bedroom. And that's their psychological way of beginning the preparation of it happening. Do you want that?
Slide that's the role of the partner, so that we can give the dad some practical guidelines with what they should, how they should behave in the market. Yeah. What should I do, or should I?
Yeah, it's men feel useless.
Yeah.
Men feel lost. They don't have a clue what to do in terms of joining the, you know, and you know, you can say there are many reasons for that, you know. And a lot of people think, oh man, they don't want to engage. And maybe they will engage if you know, I won't engage with you if you're not engaging with me. So for example, you know, if you go into the healthcare system yourself and if you're not familiar with it, it can be quite daunting. It's hard to try to navigate the system. And if you're not the patient, and if your concern is about your partner, you're certainly not going to be, you know, engaging like that. So you want somebody to interact with you more than you interacting with them. But so, you know, so the focus starts to come, and this is a quote from one of the study that's going to be published. During pregnancy, got worried, but it wasn't really until later. Then we have the birth. Okay, so again, men were not brought into the birth room until the 1970s. If you still ask the medical profession, many of them would rather the fathers not be there. They're kind of in the way a little bit. So we know that for men to transition in terms of their health, it's considered beneficial for them to be at the birth, to experience the birth, to be there to support the partner during the birth. And that has, in the qualitative literature, that has come out as being something that's considered positive. Okay, however, during this period, the fathers have felt useless, helpless, you know, that they felt, and often when there's a complicated birth and labour, rightly so, the focus is on the woman and treating the medical problem at the time. But often there can be traumatic situations. So that piece of research that I did, the fathers, one father said to me, they took my partner away. I thought she was going to die. And nobody came to me and said, she's okay. Yes, you have to look after the medical problem at that particular time. However, you know, there is something else happening outside us. I'm not saying at that moment, go on, how you feel. No, but is there a process to debrief all traumatic situations? Do we debrief for women in those situations? How are we managing that for women? How are we managing that for men? And we know through the medicalization of childbirth, the amount of C-sections happening are just extraordinary. And a C-section is surgery. Surgery for the woman, that's a huge procedure to be undergoing. And many potential complications related to having a C-section. Again, for a man who doesn't know she's having surgery, what's going to happen, you know, so again, lack of information, helplessness. However, other fathers did say, you know, that it was great relief, thanks be to God, you know, that the baby's fine. It was all about, you know, the baby's fine, the mother's fine, I'm fine. Do you know what I mean? Once that's okay, I'm okay. You know, nobody's really looking for assistance outside that, you know. And that's what kind of came out. The research was that, you know, that it's something to look out for when we talk about protective factors, when we talk about risk factors. You know, obviously a protective factor is a child who has been, or an infant who has been delivered in a situation whereby it hasn't been traumatic, there hasn't been any complications, because or there's no complications post with the infant, because a lot of the fathers said, you know, I was doing fine until the child got on well, and then he had to go to the neonatal unit. Since then, I've been extremely anxious, extremely stressed out. I'm worried about, you know, the outcome of the child is really problematic to me. But there's something simple things that you can think of. You don't have to, he doesn't have to be the patient, but you can say, well, you know, that was a traumatic birth. By God, should we ask a question? How is everything okay? You know, and this is what this whole research is about. And I've said to Inga and whoever I spoke to, like, this is not really, you know, I don't expect things to change now and everything to be about paternal perinatal mental health or the mental health. No, this is a process that's going to evolve, like Hippocrates says. where, you know, we're going to look back and we're going to say, can you believe we never considered fathers' mental health during this period? Wasn't that a bit crazy? You know, and we never really considered that, you know, men could experience such outcomes and that would really affect women. And we'd no supports, we'd no services. There will come a time when we will say that, you know, and when we will proactively promote the health of the family. But that's not going to happen today, tomorrow. I'll be back in Cork. Still won't be after happening. We have a long, long way to go. So if you look at this, I received a lot of calls during COVID to talk about, you know, asking about visitors in terms of, you know, people that would know that I have an interest in maternal perinatal mental health. You know, what do I think about this whole thing during the pandemic? So during the pandemic, and obviously we were in the middle of a pandemic, we had to take public health measures to ensure the safety of the public health. First and foremost, no question about that. We had to do what we had to do. One of the consequences of those public health measures was that fathers weren't able to be present during the birth of their infant. And the people that complained most about that and were most affected by that were the women who would have had their partners there to support them, and they didn't have their partners there to support them. But what's interesting is that when you look at what was said, it basically said that during this period, visitors will not be allowed to the maternity hospital. We know they're not patients, but we notice they're the father. Now they're visitors, you know. And what's ironic is we had many situations where, you know, fathers tended to be in what we called the same bubble as the mother. And this particular group, this particular population would have been, I suppose, more sensitive than the risks around COVID during pregnancy than other groups. So they would have taken extraordinary measures during this period. So perhaps this bubble of the father, the mother, and the infant before and during labour probably could have been one of the safest, most, you know, secure bubbles because of the, I suppose, the precautions that we've been taking. But yet we have multiple stories on newspapers, radio, where fathers were out sitting in the car waiting to get the news that their infant had been delivered. You know, it's something that, you know, was changed then, that, you know, you were able to come in for the last 10 minutes or an hour, you know, and then it got extended. But it's something to think about, you know, in terms of how we view fathers. Okay. And then the postnatal period again. And let's remember, I really want to emphasize that this is all about the transition to fatherhood in general is a real positive experience. You know, the majority of men are transitioning well, you know, they're happy, they're not stressed, they're not anxious, they're not depressed, they're really enjoying the role of fatherhood just like mothers. However, there will be a proportion that may experience this, and it's important for us to understand that. I'm not medicalizing it, I'm not sensationalizing it. I hate sensationalization of anything. So it's just something that, you know, there will be potential perhaps for some fathers. Let's be aware of that, and let's just maybe put systems in place, you know, be conscious of it, be aware of it. And that's all it is initially, to increase awareness. Like if you don't know that you can be affected by something, then, you know, so if you didn't know about COVID, nobody told you about COVID and you were going out doing what you were doing, you know, you're at greater risk. So for, you know, maybe fathers need to know that, you know, there is potential in this particular period. Okay, so then the postnatal period, again, the majority of fathers are doing fine, but fathers do tend to have a little bit of stress, a little bit of anxiety around, you know, worry. And part of that research was at least, you know, 3 fathers said to me, look, I don't have a clue what I'm doing. And my wife asks me, you know, do I know what I'm doing? And I say, yeah, because I don't want to worry her. Or she might ask a question and I don't really know you know, the right thing to do, but we plod along because I don't want to, you know, I want to make sure that I'm there. So becoming a father can be, you know, different things to different men. However, the postnatal period, there's still that whole thing around breadwinner for man and to make sure that he has provision, even though we should be more, now have dual working families and so on and so forth. You know, it's hard to break a cycle, it's hard to break a psyche, it's hard to break a culture even in terms of how we change, okay? So again, this is some of the quotes from the father, and you know, you are juggling roles. You're, you know, before you didn't have the childcare role, now there's childcare. And what you must remember is that in previous times, you know, if somebody went into hospital, they were in there for 5 days. Then it was 3 days. Now we have discharges after 24 hours. We have even normal births that are delivered and discharged after 6 hours. If they fall within a certain criteria and the pregnancy was complicated, and if they can be seen by a midwife in the community the next day, they can be delivered after, or they can be discharged after 6 hours. So that's 6 hours. That's a huge change in terms of the family dynamic, the supporting role of the father, the responsibility of the father in order to be able to, you know, to support. And it's a huge change for the mother, breastfeeding support during this period. You know, okay, we're going to, it's like the mental health, we're going to discharge early. Are we going to still support in the community? When they do need help, when they do need advice, where are we going to go for that? But again, the evidence around breastfeeding, you know, when I say to students, who is the most important person in terms of, in obviously the woman's the most important person, but in terms of the support person for supporting somebody to breastfeed, in terms of duration, it's the father. So we have a systematic review and many studies that have shown that, you know, that the father is the greatest supporter to the mother in terms of starting breastfeeding and also continuing breastfeeding. And, you know, when you look at that, you might say, how is that? But it's logical when you stop and think about it. It's logical perhaps for fathers to be stressed out during the perinatal period when they have, you know, when they have a crying infant, they might have a partner who's physically unwell post a C-section, you have to go back to work, the infant is calling. Like, surely these are stressful situations. Like, you know, I love to make it simple, you know, and I should be able to walk into a bar or a public house and say to somebody, do you know that in this situation when there's a new baby that doesn't sleep, you know, and there's a partner who has had a medical procedure and is anxious and is concerned about breastfeeding, that person could be stressed. Do you think that person, you know, we found that that person will be stressed and anxious? I'd expect them to say to me, Lloyd, I could have told you that you didn't need to go away and talk to 500 people at all. Do you know what I mean? It's even logical as far, in my mind, it's logical. And I've looked at the evidence. It's logical to be able to say, you know, there is potential here, okay? And then the later postnatal period. And again, how do we'll talk a bit about paternity leave as well, okay? So, yeah. So a lot, they feel inadequate, ill-equipped, lacking supports, and that can result in stress, anxiety, depression, okay? So that leads me on then to, you know, so that's the transition. That's the important bit, isn't it? You know, we could stop now. We're not going to, but we could. And we could say, well, that was hopefully, you can ask any questions you want, but you can say, hopefully that was, you know, something the evidence spoke to me. And it's something that perhaps I can take into my practice in some way. You can't change the world for everybody, but you can change the world for one person. So maybe it's the father that you meet that you think is struggling, you know, and that's the same with the mother that you meet. Do you know what I mean? There's very few people change the world. You know, most people just, you know, it's the simple interactions, it's the simple communications, you know, that really change people's experiences. So what is your experience? So the hotel I'm staying at, if I go there and if the guy at the reception is not nice, then I'm a bit peed off. And then I go to the room, I go, you know, then my experience at the hotel is, you know, everybody else might be nice, but you know, TripAdvisor, you know, but you know, so the people that you meet make your experiences. That's the reality. That's the same for me, same for you, whether you're in healthcare, whether you go to the shop. You know, so we can change things. And look, it's only how many people here, it's all about awareness. You know, is this something that might be impacting on the population you're looking at? I'm not